Good evening, Professor Boulton. What do you think is the concept about remote decare monitoring?
I think one of the problems we have is that patients obviously live not in the clinic, but they live a distance, and in some countries, for example Australia, people are living hundreds of miles from the clinic in the rural area. And I think to have access to patients' blood glucose records via remote monitoring is a great asset for the future.
Thanks a lot. And how do you plan to give services to diabetes patients remotely? What are the kind of services that can be given remotely to the patients?
Again, it's monitoring of sugars and having some kind of warning signal if the blood glucose or the tissue glucose goes above a certain level, then this would trigger some contact. And I think in this regard, the diabetes specialist nurse, which is a model so well developed in Europe, particularly in the UK with nurse educators, this is a vital area. These people are part of our team. We're all, it's a bit like communism, we're all equal. And we regard the nurses as our advisors. And I regard the nurses as excellent in monitoring blood glucoses, advising on insulin dose changes. And it may be that the nurse is the individual who telephones the patient when they get this warning remotely that the blood sugars are perhaps running a little high.